What is it? Borderline personality disorder is a lifelong mental illness that causes impulsive behavior and problems in relationships. What causes it? Borderline personality disorder is often caused by childhood trauma or other types of traumatic experiences that occurred during early life. This diagram is showing the different types of things that can lead to borderline personality disorder. Symptoms. Some symptoms of borderline personality disorder include isolation from others, body dysmorphia, impulsive habits, self-harm and suicidal thoughts, drug abuse, anxiety disorders, and people with borderline personality disorder often have very black and white thinking. Black and white thinking is when people only see things as super good or super bad. People with borderline personality disorder commonly have this issue. It makes it very hard to maintain good relationships and positive emotions. They cannot control when their emotions switch, so they can easily go from having the best day to the worst. Risk factors. While borderline personality disorder can be caused by genetics and there is a higher risk of having it if someone in your family does, it is also immensely affected by how you were raised and if you went through any abuse or traumatic experiences. Solutions. You can never truly get rid of borderline personality disorder, but you can lessen the symptoms by improving your self-care, taking medications, having peer support, and going through different types of therapy. Some types of therapy include dialectical behavior and cognitive behavior therapy. Dialectical behavior therapy, also known as DBT, is a type of therapy made by a psychologist named Marcia M. Lineham in the 1900s. It was designed to specifically treat borderline personality disorder. Dialectical behavior therapy contains 4 main steps. The first step is individual therapy, which is 1 hour a week, so one-on-one with the therapist. The second step is a group skills training, which is 2.5 hours a week. The third step is a therapist consultation team, which meets 1 to 1.5 hours a week. And the fourth step is phone coaching for whenever a patient may need to talk. How severe is it? This illness is very serious because it can cause severe depression and self-harm. It obviously differs for every patient, though. There is sadly no cure for this illness, but there are types of ways to lessen the symptoms. This disorder is usually formed before the personality is fully developed, so before the age of 4. Parenting and life at home immensely affect the children's personalities. Many patients with borderline personality disorder are often misdiagnosed with other mental illnesses. 40% of people with borderline personality disorder have been misdiagnosed with bipolar disorder. Those disorders are very different, and mixing them up can severely damage a patient's mind. Sammy Grimm. Sammy Grimm is a woman with borderline personality disorder. She was misdiagnosed twice with bipolar disorder. She is very impulsive and says she has no control or sense of her own identity. She is constantly terrified of people leaving her like her boyfriend. She has black and white thinking, and all of her emotions feel very intense. She has dealt with severe depression and self-harm. Sammy Grimm suffers the average symptoms that patients with this disorder go through. Sammy was finally diagnosed correctly, and she was excited to get better. She got very depressed after researching too much, though, and comprehending that there was no cure for her. She stopped working, and for 8 months, this disorder took over her life. She finally decided to switch up her perspective and strive to get better. She turned to her extremely supportive boyfriend and therapy to help her manage her symptoms and is much happier now. Sammy believes her childhood is the reason for this disorder occurring in her life. Growing up, she was practically raising herself and siblings due to her mentally ill and drug-abused mother. Sammy claims that if she had a normal childhood, she would not have borderline personality disorder. Sammy wants to get as much help as she can so she is not like her mother and can prevent her children from having this disorder as well. She wanted to reduce the stigma around the illness, so she began making YouTube videos explaining her stories and how poorly borderline personality disorder is portrayed in movies. Sammy Grimm is just one of the many patients that are speaking out about how their illness is wrongly portrayed in media.